my name is Mandy and I am a registered veterinary technician at Pet Vet Eastside. To become a registered veterinary technician, a person must complete a 2-year program at an accredited college and pass a licensing exam. Part of my training during those 2 years involved learning how to safely administer anesthesia, monitor vitals during surgery, and how to perform dental cleanings. Today we'll be performing a scaling and polishing on our patient, Philly. To make Philly feel as comfortable as possible, I make sure to stay by her side for the entire procedure from start to finish. Philly is going to have a general anesthetic during the procedure so that she won't experience any stress or discomfort. Before we go ahead with the procedure, it was important to perform blood work to check on her liver and kidneys, since those organs are responsible for processing the anesthesia she'll be receiving. Let's start in our lab.
Here we have Dr. Both referring to our in-house blood analyzers to ensure that Philly's liver and kidney values are within the normal limits. As you can see, both are normal, and that's great news for Philly. Now that we know her liver and kidneys can handle the anesthetic, we give her an injection to make her feel sleepy before we begin any work on her. This is to help make this process as stress-free as possible for Philly. We let Philly lay in her comfy bed and make sure to keep the room quiet while we watch her start to feel sleepy, and once she is ready, we move her into our dental suite to get started. We let Philly lay on her comfy bed in the dental suite, and I place an intravenous catheter into her front leg. Thankfully, she is sedated so that this isn't scary for her. First, we shave a small area on her leg, then clean the area thoroughly. We place the IV catheter and then tape it into place. It is very important to have Philly hooked up to IV fluids throughout the procedure to help maintain blood pressure and to keep her hydrated. It is also crucial to have access to a vein established, just in case of any emergencies. In other words, having Philly on IV fluids during the procedure makes this process even safer. Philly will continue to stay hooked up to her IV fluids for several hours after the cleaning and polishing to help flush the anesthetic through her system so that she can feel back to her normal self as quickly as possible. Next, we take her blood pressure readings and listen to her heart once again to confirm it is safe to proceed with the anesthesia. We will continue to monitor her vitals during surgery. We monitor her blood pressure, her heart rate, the amount of oxygen being delivered throughout her body, her respiration rate, as well as the amount of carbon dioxide that she is exhaling. When it is determined to be safe to proceed, we give Philly what we call an induction agent, which is an injectable anesthetic. This will make her unconscious, and she will be completely unaware of anything going on after this point. From this point on, she'll be dreaming of how she plans on finally catching that pesky neighborhood squirrel. This allows us to be able to place an endotracheal tube into her trachea. It is very important to do this so that we can maintain her airway, monitor her breathing, and administer oxygen combined with the gas that keeps her sleeping for the entire procedure. It's also important to have her airway maintained so that none of the fluids being used in her mouth go down her windpipes, since she won't be able to swallow when she's anesthetized. We will hook Philly up to a tube that is delivering the oxygen combined with the gas that will keep her anesthetized for the entire dental procedure. Once anesthetized, we begin with taking x-rays of her teeth. It is important for the doctor to look at the entire tooth from root to tip to ensure the health of each tooth. It is impossible to say for certain how healthy a tooth really is by just looking at what we see above the gum line. Here we have Dr. Both reviewing Philly's x-rays to ensure that there are no issues under the gum line, and thankfully for Philly, everything looked great. Now we begin the cleaning process. We are using an ultrasonic scaler to remove the tartar from Philly's teeth. I use a face shield and mask to protect myself from the bacteria. This scaler can be quite loud. That's another reason why we want to make sure she's anesthetized. Let's turn the noise up so you can hear.
We can probably just videotape me afterwards looking at the
Once the bulk of the tartar is off the teeth, we use a curette to pull any tartar off that has made its way under the gum line. We wouldn't want to leave any of that bacteria-laden plaque under the gum line to cause problems. Afterwards, the doctor probes the teeth to check for pockets, which is a sign of infection under the gum line. Now that they're clean, we can polish the teeth. This smooths the surfaces of the teeth to discourage plaque from sticking to them as easily. The paste we use has fluoride in it, which helps to strengthen the enamel. As you can see, as we're polishing, Philly's gingivitis is causing a little bit of bleeding near the front of her mouth, but don't worry, gingivitis can be reversed with proper oral care. We make sure to thoroughly flush out Philly's mouth to remove excess debris such as tartar and fluoride paste. We then transfer her back to her comfy bed before she starts to wake up. We tuck her in, talk softly to her, and pet her while she wakes up. We make sure to make this transition as smooth as possible, so we like to take our time with her during this process. Once she's awake, we can remove her endotracheal tube, and I won't leave Philly until I know for sure that she is comfortable and aware of her surroundings. She will be a little sleepy for a few hours, but I make sure she is comfortable before I let her have a rest in her comfy bed. During Philly's discharge, we will go over her individual results and needs, show her owner her x-rays, as well as go over her custom home care plan to keep her mouth healthy. Philly leaves that same evening a very happy dog with a very happy mouth.